The 9 hospitals the Auditor General assessed include Mityana, Moroto, Iganga, Ntebe and Anaka. Others are Chiriandongo, Nebi, Moyo and Nakaseke. Senior officials from the Ministry of Health, led by the Permanent Secretary, Dr. Asman Lukwago, who appeared before the Parliament's Public Accounts Committee, were first put under oath before they started to respond to queries.
Do solemnly swear that the evidence I shall give.
Engineers from the Auditor General's office, who assessed the hospital buildings, found out that some had already developed cracks.
The contractors would continue doing work at night without the eye of the contract manager.
Your floors are cracking. The terrazzo is of unbelievable quality.
If you go to Chiriandongo, you realize there are cracks on the walls, not even on the floor. You get the point?
In all civil works projects, you cannot have zero defects.
The engineers further recommended periodic testing of these structures every 5 years because of the risk they pose to the users.
Yeah, Engineer John, you are trying.
I don't want you to be proud of defects.
You are so proud, and
it is not right. You cannot be here and tell us how they are normal.
Cracks.
Yet you have 2 cracks in hospital.
The test on the building was proved that the mixtures were not consistent. And that is going to cost us a lower lifetime of the building that would have been expected.
Actually, I'm even constituting a team which is going to do an structural audit, leave alone this audit for money, constituted by architects from Ministry of Works, to give me a report before the end of the defect liability time.
These 9 hospitals are part of the health facilities under a government program to renovate 17 general hospitals and 27 health center fours. A $130 billion loan, approximately 440 million shillings, was secured for that purpose, which should also see 2 general referral hospitals upgraded. Committee members were also shocked to learn that the cost of renovating the 9 hospitals exceeded the budget by over 4.2 billion shillings. The Auditor General's report indicates that renovating Mityana Hospital exceeded budget by 355 million shillings, Entebbe by 677 million, Nakaseke by 1.2 billion, Nebi by 747 million, and Chiriandongo by 647 million.
Do you know the explanation you are giving in your responses, Permanent Secretary? That this included the cost of cutting trees.
Given that management of the works is stakeholder driven and new demands keep coming up during implementation meetings, it becomes difficult to ignore the new stakeholder requests for inclusion in the project.
The Ministry of Health officials will again appear before the committee to answer to more audit queries raised in the Auditor General's report of 2014-2015. Herbert Ziwa, NTV at Parliament.